Greetings everyone, I'm Dr. Anth. In the prior video, I explained how skin color variation in humans was related to UVB radiation exposure and vitamin D. In this video, I will explain the dangers to your health if you do not produce enough vitamin D. I have published scientific articles on the subject of vitamin D deprivation. Links to those articles are in the description box below. Let's go back to the 17th and 18th centuries when England began colonizing the world. Look at this map to remind yourself that England is located in the far north of the temperate zone. England's first colonies in North America were further south, but still in the temperate zone. But then England decided to colonize Australia in the late 18th century. Australia is primarily in the equatorial subtropical zone. These English colonizers had very light skin and wore a lot of clothing. They were not particularly well adapted to an equatorial environment. But their fully clothed bodies did protect them from overexposure to UVB radiation. The indigenous Australians, on the other hand, were well adapted to the equatorial environment. Over the late 20th century and into the 21st century, Australians with very light skin began wearing less and less clothing, especially on the beach. Along with this change came a dramatic rise in skin cancers in this population. The Australian government began a campaign to encourage people to slip on a long-sleeve shirt, slap on a hat, and slop on sunscreen all over their faces and bodies. While these measures did reduce the incidence of skin cancer in the light-skinned population, they also reduced the ability of these individuals to produce vitamin D. Vitamin D deprivation is associated with bone disorders such as rickets. Watch the prior video, the link is in the description box below. Osteoporosis, which occurs in about 50% of women over age 70, reduced muscle strength, autoimmune disorders such as multiple sclerosis, type 1 diabetes, and rheumatoid arthritis, cancers of the prostate, colon, and breast, hypertension and cardiovascular disease, and brain disorders such as Alzheimer's and Parkinson's disease. Vitamin D deprivation can be extremely dangerous to your health. Balancing too much exposure to UVB radiation with too little exposure took humans thousands of years of adaptation. In the past few hundred years, and especially in the past century, humans well adapted for the temperate zone now live in the equatorial zone. Humans well adapted for the equatorial zone now live in the temperate zone. Anyone who lives in the temperate zone and has no opportunity to expose bare skin to UVB radiation between the hours of 10 a.m. and 3 p.m. during the summer months will probably have some level of vitamin D deprivation. This would include pretty much anyone who works indoors or goes to school. Unless you work outdoors, you should assume that your vitamin D levels are too low. How long you would need to be outside between 10 a.m. and 3 p.m. during the summer months in order to get enough UVB exposure depends on your skin color. If your skin color is very light, then 15 minutes a day of exposing bare skin, no sunscreen or sunblock, may be enough to optimize your vitamin D levels. The darker your skin, the longer the time you need to be outside. If you have very dark skin and live in the higher latitudes of the temperate zone, even spending the entire 5 hours from 10 a.m. to 3 p.m. outside may not be enough to optimize your vitamin D levels. The best way to raise your vitamin D levels is to take a vitamin D supplement. You may think you could get enough vitamin D from your food, but this is not the case. You also may think taking a multivitamin would be sufficient. This is also not the case. If you have any of the health problems I listed earlier, you need to discuss vitamin D supplementation with your physician. You should probably have a vitamin D test done to determine your level of 25 OHD. If it is below 32 nanograms per milliliter, your physician should prescribe a supplement. If you do not have any of the listed health problems and do not work outdoors, you may wish to consider a vitamin D supplement. The supplement needs to be vitamin D3. It also should not be combined with calcium or with anything else. From late fall to late spring, I take 4,000 international units a day of vitamin D3. During the rest of the year, I take 2,000 units. Research has shown a daily dosage of 10,000 international units a day is fine for healthy adults, but I would stay between 2,000 and 4,000, unless you are prescribed more by your physician. Vitamin D deprivation is a serious issue. If you are unable to get appropriate UVB exposure, you should consider taking a vitamin D3 supplement. Thanks for watching, and please subscribe to my channel.